my entire career of 34 years has been devoted to the facial nerve. For example, tumors that are next to the brain that need to be removed, and the facial nerve is closely adhered to the tumor. Disorders within the temporal bone, cysts or tumors, and also tumors that are in the facial area. The busiest part of my practice is Bell's palsy. Bell's palsy is a virus attack of that facial nerve, which causes swelling. The good news is about 85% of patients with Bell's palsy will get better on their own, usually within a month. It's the patients who don't improve, that 15%, where their face is still paralyzed after 3 months. We have determined that electrical stimulation of the nerve inside of the mastoid bone can help that nerve recover faster, which then gives the patient a more natural recovery of the nerve. There are patients that have hearing loss for many reasons. The cochlear implant is a surgical procedure that's done basically for patients that are so profoundly deafened that they gain no benefit from a hearing aid. And cochlear implants at our institution have really taken off. I think the biggest draw is knowing that the team that you are seeing at Loyola have been together for such a long time, and that has translated into our center becoming one of the biggest in the country and with the best results. When you see a patient smile and thank you that they can hear, thank you because the tumor's out and their face works normally, they're back to work, their balance is stable, it feels great.